Well, our results are that we started with people with mostly long-standing diabetes. So the average duration of since diagnosis was over 8 years, and they're quite heavy. We actually, we don't make a big deal out of it because it really did make a difference. But half of when we recruited almost 400 people with either pre-diabetes or diabetes, the diabetes cohort numbered 260 patients. And we had about 130 people with pre-diabetes. And they were allowed to select between either coming into meetings in Dr. Hallberg's clinic, so coming to the bricks and mortar clinic and meeting 26 times over the course of 1 year for group-based plus one-on-one sessions for individualization. But that's how I know, in my previous experience with using ketogenic diets for weight loss, I knew I could do it that way in a group-based intervention. And then because they had diabetes and on medications, they had telephone access to Dr. Hallberg and to their coach to help them with the prompt changes in medication that are required for this to be safe. The other group got all this instruction and interaction through through a cell phone app. They didn't come in except for research visits 3 times over the course of the first year. And I knew I could do it in a group-based setting, but again, like my experience with thinking I knew better, I figured that doing this in an impersonal way, doing it pure telemedicine through an app, was not going to work as well. And the answer is there were no significant differences between the results of the two groups, but on average, the app-based group did slightly better.
Wow.
So again, it's a situation, I love this in science because the beauty of science is actually coming up with a hypothesis that you think is right and improving it wrong.
Right. Yeah.
That's what science should be. And I won't give you the long list of places where I've been proving myself wrong, but something I just like to do because it means we can learn from doing these things. But anyway, the result is that at 1 year, the hemoglobin A1C, which started out at 7.6, and most of these patients were on multiple medications, dropped to 6.2.
Wow.
And we removed more than half of their medications. For those people on insulin, there were 90 patients on insulin, and half of those patients, we completely removed the insulin. Some of them have been on it for years.
Wow.
And in 42%, so 50% we stopped the insulin, and 42% we reduced the dose. We stopped all sulfonylureas. And insulin and sulfonylureas are the 2 most dangerous medications in terms of causing hypoglycemia. And then most other medications other than metformin, we had actually reduced the amount of medication. And so we got a very significant reduction in hemoglobin A1C with less medicine, which every diabetologist tells you it's so counterintuitive that they'd all think it would be impossible. Well, 2 things. One is we have kind of promoted the term reversal because it's not cure and it's not remission. It isn't like, you can stop doing this treatment now and you'll be okay. You have to once you have type 2 diabetes as a severity that our average patient had, we can't stop the carb restriction. We can individualize it, and people's carb tolerance will vary one from another. So we like the term reversal because it's an active process. If you go down a dead-end street and you realize it's a dead-end street, you can turn around and go back the other way. So you're reversing, going the other way backwards, but you're moving. It's a dynamic process, whereas remission or cure would not be considered a dynamic process. And our patients have to understand that this is an ongoing active thing they have to do to achieve success.